Welcome, Dr. Manju Churani is our Dean of our faculty.
Thank you.
Anil Srivastava, who is the President, and this is Jyothika Bijlani, who is the Dean of Academic Council of Occupational Therapy. So we can start now.
Yes.
Noor, please start.
Yes.
Okay, ma'am.
Yeah. So, good afternoon, everyone, and welcome to the fourth webinar in series on behalf of our Honorable Vice Chancellor, Professor Saeed Ehsan Hasnain, Pro-Vice Chancellor, Professor Ahmed Kamal, and Department of Rehabilitation Sciences, School of Nursing Sciences and Allied Health, Jamia Hamdard. So, in previous three webinars, actually, we got overwhelming response, and that encouraged us to organize this fourth one. And in continuation, this one is organized in collaboration with All India Occupational Therapist Association on Smart Clinical Occupational Therapy Plan during COVID-19 lockdown. And the main aim is to create the various platform for e-learning modes and instructions and a ways to prepare the students. There's a lot of disturbance.
All of you, please switch off your microphones. All the participants, please switch off your microphones.
Yeah. So we are trying to provide the platform, e-platform, whereby they can learn the clinical skills as well. Because in all professions, wherever the skill part is involved, it is becoming a problem because everyone is scared. Nobody wants to come out and go to that clinical field. And naturally, we have to design some measures to provide that experience too. In nursing also, I have come across, yesterday we had a meeting with WIMHANS people from WIMHANS, and they have developed a package of videos, case scenarios, case studies, through which they will teach our students whole clinical posting package, which we were providing by sending them there. So same way we have to develop various means by which we can provide the quality training and same kind of exposure and learning can be given. So this is one of the steps which I think in this webinar we are going to have Dr. Jyothika Bijlani, who is a Dean ACOT, member of IOTA, and Professor HOD School of Occupational Therapy, and also member of editorial board of your journal, main journal, which you have. So we have all renowned people with us who are going to, I think they have tried with this package of e-learning on this. And we also will have an address by Dr. Sebastian Anita D'Souza and also Dr. Anurupa Senapati and Dr. Ruchi Nagar, our own associate professor from Jamia Hamdard. And I think considering the circumstances for this semester at least, and also we need to plan for the next semester, e-learning packages. And I think e-consultation in the field of rehabilitation sciences, including occupational therapy and physiotherapy, we need to think on those lines and start preparing for these things. So with these words, I welcome all the renowned speakers who have been with us for this 2-hour seminar. And I hope that everyone will get benefited out of this. Thank you so much.
Thank you. We'd also like to welcome Dr. A.K. Srivastava, the President of AIOTA.
Okay.
And he's there to give a motivational address to all of us. Yes, Noor, you can
Yes, ma'am.
invite sir.
Yes, ma'am. Hello and good afternoon to everyone. I feel privileged to extend my warm welcome.
Unmute.
Sorry.
Noor, unmute yourself.
Sorry. Yeah, fine.
Yes.
Okay. Hello and good afternoon to everyone. I feel privileged to extend my warm welcome to all the dignitaries and participants. Thank you for joining us today. I am Noor Mohammed, Assistant Professor, Occupational Therapy, Department of Rehabilitation Sciences, School of Nursing Sciences and Allied Health, Jamia Hamdard. Before beginning today's webinar, I would like to request all the participants on Google Meet to kindly switch off their cameras and put their mics on mute to avoid background disturbances during the webinar. All the participants, please feel free to put their questions in the comment box in the end of webinar. We have received an overwhelming response for today's webinar. We have received more than 950 registrations from India and abroad. We are conducting today's webinar on Google Meet platform and streaming live broadcast on YouTube. Education is the most powerful weapon which you can use to change the world, as said by Nelson Mandela. Countries all over the world are witnessing the devastating effect of pandemic COVID-19 on people, specifically on teachers and students community. Despite enormous changes occurring in our social and personal lives, COVID-19 has shown new way of life that will immensely contribute to the resilience and recovery of each and every human being. A great visionary, Dr. APJ Abdul Kalam, once said, "Remember, without the difficult times in your life, you wouldn't be who you are today. Be grateful for the good and the bad." Today we are presenting the webinar on topic Smart Clinical Occupational Therapy Educational Plan during COVID-19 lockdown, which is issued by Academic Council of Occupational Therapy of All India Occupational Therapists Association. This webinar is organized by Department of Rehabilitation Sciences, School of Nursing Sciences and Allied Health, Jamia Hamdard, in association with All India Occupational Therapists Association, under the patronage of Professor Dr. Syed Ehtesham Hasnain, Vice Chancellor, Jamia Hamdard, and Dr. Ahmed Kamal, Pro Vice Chancellor, Jamia Hamdard. Jamia Hamdard is recommended as Institute of Eminence by Ministry of Human Resource Development, Government of India. It is also Grade A accredited by National Assessment and Accreditation Council (NAC). Recently, Jamia Hamdard ranked first as Best Pharmacy Institute in National Institute Ranking Framework 2020. We are also grateful to All India Occupational Therapists Association for being generous and giving us the opportunity to share the guidelines through our webinar. Proceeding further, we are joined by our dignitaries. I welcome Professor Ona P. Desai, Head, Department of Rehabilitation Sciences, Jamia Hamdard. Professor Dr. Manju Chughani, Dean, School of Nursing Sciences and Allied Health, Jamia Hamdard. Dr. Anil K. Srivastava, Honorable Prime President, All India Occupational Therapists Association. I also welcome panelists for today's webinar, Dr. Sebestina Anita D'Souza, Professor, Department of Occupational Therapy, Manipal Academy of Higher Education, Dr. Anurupa Senapati, Head, Department of Occupational Therapy, Swami Vivekanand, National Institute of Rehabilitation and Training and Research, Odisha, Dr. Ruchi Nagar Bakshi, Associate Professor, Department of Rehabilitation Sciences, Jamia Hamdard. I will invite and request Professor Ona P. Desai to spare few words.
We can start right away with Dr. A.K. Srivastava's address.
Okay, ma'am.
Dr. A.K. Srivastava, you can ask sir to address
Yes, ma'am.
the thing and then we can start from there.
Yes, ma'am.
And welcome even Dr. R.K. Sharma. He is head of Dean from the Santosh Medical College.
Yes, ma'am. Now I will invite and request Dr. Anil K. Srivastava to address the audience, please. Welcome, sir.
Again, he's there. Deepak.
Dr. Anil Srivastava, sir, can we have you?
Srivastava, sir? He's there. He had joined.
Can you again, should I call him?
Yeah, ma'am.
Till such time, if you would like Dr. Jyothika Bijlani to
Yes,
say
ma'am.
something, I'll just call Dr. Shiva.
Yes, ma'am. Now allow me to welcome and introduce our speaker for today, Dr. Jyothika Bijlani. Dr. Jyothika Bijlani, she is specialized in neurodevelopmental disorders, certified in neurodevelopmental techniques from London, certified in sensory integration from University of Southern California. She is fellow of Academic Council of Occupational Therapy. At present, she is working as consultant occupational therapist. She is a dean, Academic Council of Occupational Therapy of IOTA, AIOTA, member of Educational Reviewing Committee of World Federation of Occupational Therapy, and member of Indian Journal of Occupational Therapy Advisory Board of AIOTA. In past, she worked as clinician and academician in occupational therapy schools and centers, said GS Medical College and KEM Hospital for 35 years, and retired as professor and head of LTMM College and Hospital. She was a committee member of UG and PG Board of Studies and PG Guide and Examiner of Maharashtra University of Health and Science and other universities of India. She is currently involved as Principal Coordinator of AIOTA Annual Fellowship Program in Advanced Occupational Therapy, AIOTA Certificate Courses in Video Modules during COVID-19, Office Ergonomics, PAM OT, Driver Rehabilitation, Wheelchair Seating and Mobility, annual courses in Research Methodology and Art of Writing and e-learning courses of US. In her credit, she has many publications in national and international journals and AIOTA Smart Clinical Occupational Therapy Educational Plan during COVID-19 lockdown. She has been awarded Best Scientific Paper in Kolkata, Best Splinting during OTCon held in Delhi. She has been the resource person in workshops and seminars on early intervention in neonatal occupational therapy, advanced occupational therapy in neurodevelopmental disorders held during national and international conferences. It is my great honor and privilege to welcome Dr. Jyothika Bijlani. We welcome you, ma'am.
Thank you. If Dr. A.K. Srivastava has come, otherwise please start and we can ask him to join.
Ma'am,
I think he has joined.
Ma'am, he is there actually. He is there. Perhaps he has not, unmute his mic. He is there.
But then he should be able to. Okay, fine. So would we have Dr. A.K. Srivastava's address? We are trying to call him. Till that time,
Only he can unmute himself. I cannot unmute himself. He can.
No, we can call him. In the meantime, she can start.
yes, ma'am, we can
Okay,
start.
ma'am. Okay.
So I have to start or
Yes, ma'am.
you are waiting for Dr. Srivastava?
Please.
No, but then there will be, I'll just try once with Dr. Srivastava.
हाँ, हाँ. नहीं.
सर आपने अपने को अनम्यूट किया है आपको क्या आपको नहीं हो रहा है आपको आपने ज्वाइन मीटिंग किया
We have people from Manipal and we have Anil. Yes.
Hello, can I just disturb you, Ona? He's saying that he has opened it, but his video and audio both are showing cross, and he's trying to click it, but it is not going. I don't know. It is a problem from your side or his side.
He's not. I'll tell
Both
you.
audio and video, both are not.
Ma'am, the problem is from his side only.
He's trying to click it, but it is not.
The problem is from his side.
Okay, ma'am.
We can in the
no
meantime
problem.
start this. I will
Start
just
with,
tell-
yes.
Ma'am, we can start.
We can start,
I'll try
ma'am.
to contact
I'm
with sir.
asking to log off and rejoin.
Yes.
Okay.
He should rejoin. He should rejoin.
Swati, ask Dr. A.K. Srivastava to rejoin. Do the whole thing again. In the meantime, actually, this pandemic, we don't know which way it is going, and we don't know how long this will continue. So, what we have decided is that we had our for bodies who are giving us guidelines on SOPs. And AIOTA is a professional body which has been there for very long, and they have done a lot of work. They are looking at the e-learning modules for students, as well as they are looking at the clinical modules which we could practice for our patient care. So they have brought out both these modules, and we thought that as a university, and maybe Manipal and Nittar, and there could be guidelines which they could be followed from the AIOTA or any of our councils. And we are trying to evolve SOPs along their lines. So would you like to share something on that, Dr. Jyothika?
Yeah, actually, Ona, I actually did not hear you properly, and frankly speaking, I was talking to Dr. Srivastava on telephone. So can you just again repeat your question, if you don't mind?
That you have developed these modules and clinical modules.
Yes.
So we will evolve these SOPs to be able to the different universities, for different universities.
Yes.
So
Yes.
you throw light on that.
Yes, definitely, because what we have thought in considering the public at large, not as a specific university or a specific college or something of that sort. So what we realized is that as we have considered the minimum standards of education, what we have it for the OT education in India, which has been also recognized by World Federation. So considering that the people have to complete so many hours of clinical training, demonstration, practicals, and which we realized that they are not been able to complete because of this lockdown or because the people are not been able to join in. So we thought that we will give you some idea, like exactly what platforms to use it and what are the mode of instructions and what are the tasks to be given and how the teachers have to prepare it and what topics can be easily conducted online. So those SOPs are to be definitely to be prepared by you people, but to some limit our SOPs, if you go through it, our guidelines, if you go through it, you can little bit modify as per the requirements and the your university needs it. According to your needs, according to your requirement, you can modify it and do it. But this is just a recommendation, some suggestions, some guidelines which you can go through it. Yeah.
We can start.
Has it joined?
Yes. I'll just. Would you like to say anything? Yes, sir. Okay, sir. Okay, we'll tell Anita to start in the meantime. Okay. You tell us when you join. You can go. Please start.
So I'll start? Okay.
Yes.
So I'll share my slides.
He's trying to join from the mobile. He'll join later, but we'll start.
Okay. Yeah, first, can you see the slides?
Yes.
Yes, ma'am.
Yeah, first let me thank Dr. Syed Hussain, the Vice Chancellor of Jamia Hamdard, and Dr. Ahmed Kamal, Pro Vice Chancellor. And I should not forget to thank my friend, Dr. Ona Desai, who is my friend, colleague, everything. We were working together. And I'm happy that she's HOD of Rehab Sciences, Jamia Hamdard. And I also would like to thank Dr. Manju Chubani, who is Dean of Nursing and Allied Health Sciences, to give me this opportunity. I'm really honored to have with you, and I'm grateful to you all to organize this such a big platform, and so that everybody will be benefited. I'm sure the people will be benefited. And I would also like to Anil Srivastava, actually, who is our pillar and who has been the backbone of our association and academic council, because he has got exemplary vision, and he's been throughout very supportive and cooperative, and whenever whatever we think of doing something, he is always ready for it. So without him, I don't think this document would have been ready and we would have been in front of you. So thank you all of you to give me this opportunity to be in front of you and present you. So I'll, without delaying it, I would introduce, I think I've been already introduced, so I don't want to waste my time. But then I want to say that when and why and why we thought of doing this and what we thought of doing this. And when everybody knows, because the world has come to the standstill. I should say nearly a full world has come to standstill, and the education is also at halt. So we, the educationalists, have a great challenge in front of us, and this pandemic novel, the coronavirus, has driven us to look for the educational reforms in all the fields globally, and occupational therapy program is not the exception to it. So as per the Ministry of Human Resource Department, who has always been encouraging the use of Diksha, and we thought that this is a good opportunity, good platform, that we should prepare something. And also because there was a need based from the government of India, so IOTA and WFOT, that is World Federation, we perceived the need for supporting our students and faculty, because there was too much of a problem. We realized it that taking lectures and this was easy online. Okay, just give the lecture. But as far as the clinical program was concerned, like the demonstration or practicals or something, and the handling the patients, which is next to impossible during this time. So we thought that we should prepare something, and also to complete the clinical hours, which is very important. So the clinical placement of the students, and to complete that minimum standards what we require it for the clinical work, also will be fulfilled. So even our MCI and along with Niti Aayog, they have also been encouraging the telemedicine consultation. UGC also has. Yes.
Sir has come. If he can unmute himself, I'll tell you.
Yes.
Please continue, I'll tell him.
Okay. So I'll just finish this slide. So module is based on various evidences from other fields of sciences and suggests a novel way of clinical teaching guidelines. And I also previously I said that we are just recommending these guidelines, which other institutes and universities can make changes or make modifications according to that.
Sir, just unmute yourself. Please unmute yourself. Simple. Hello? Yeah. I think that you should continue with each sir can unmute himself. Dr. Jyothika, continue if he can unmute with the seat.
Shall I continue? Shall I continue or what? I can't see anybody actually speaking.
Please, you continue. You continue.
Yeah, okay. So the objectives of the program, everybody has to understand that only sitting in front of the laptop or desktop will not be so much, entertaining also. Like, it should be more lively when you attend the lectures or when you are in doing the clinical work. You are talking personally to the patient, talking personally to the to your teacher or the faculty. So it has to be more of an interactive session also, even the e-learning program. So that's what I thought that we should, and so that there should be some doubts and everything should be cleared out even during the online session. So this is what our objective is, that the students should be able to learn in a participative learning program. It is not only just sunke nikal jao bas ho gaya kaam khatam. So the session also should challenge to solve the problem. So we have to give some tasks, some activities to people so that they use their own work and theories and they themselves learn also. And there has to be some active learning process even in situation of a lockdown or home quarantine. So, and also definitely this is also most important to complete the clinical training.
Sorry to interrupt you, ma'am. Please activate your slideshow.
Yes.
Sorry, ma'am. Thanks.
So to complete the clinical training and also the credit hours and the learning the platform, which is always I feel it should be easy to operate and cyber secure, because as usual now we have been hearing the Zoom and all is not very much secured and all that. But anyway, that is everybody's point of view. But this has to be considered whenever you are choosing some programs. Shall I continue? Yeah. So which platform to be used? So everybody is, now this is today's, we are using Google Meet. So same way we have a Google Hangout, we have a Google Drive, Google Meet, Classrooms, Geo. We have a Skype, but only Skype, there is a problem that you can't share your presentations and all, but you can definitely have a good discussion and all that. Zoom is everyone is been using and it works well. Only the limitation is that the number of people are not more than 100, while in others you can use more people also. WhatsApp, when I always thought that WhatsApp video calling is also quite good, because the students suppose are placed in pediatrics, where only the teacher who is concerned in the pediatric clinic. So she has got 4 or 5 students under her. So for the smaller group, I feel the video WhatsApp, there will be a direct contact with the teacher and their colleagues, the group. They can also use the WhatsApp video calling also. Say Namaste is a new one now. It is also now in practice. We can also use that. Telegram video is again, it's a quite big number. You can use it. So these are the different, depends upon the number of people you have. It depends upon whether you have the presentation to show, whether you have some videos to show. So you can choose anything as per your convenience. So what are our expectations? Why it's very easy to say that, okay, come on teacher, you start doing it, who has never done this before, or the students also who have never used this platform for the learning point of view. They might have used it for the emails and YouTube videos and other things. So that is what is important, that the readiness of the teacher and the student is very important. Not only the cognitively, but also they should be psychologically, like emotionally, oh, how will I do it, whether I will be able to do it or not, and whether they should be cognitively understand how to use these different type of platforms. So it's also very important. So readiness of the teacher and the student both should be considered. And definitely once they are ready, then the preparation. So preparation by the teacher is different and preparation by the students are different. So preparation by the teacher for the clinical teaching, group discussions, how to do the assessment, how to show them the assessment. And also again, same way, vice versa for the students, because the student will be given the task or the activity, so he has to present it next time. He has to make some submissions, whatever the task or activity is been given, and also the group discussion, interaction during the group, and the examination. So I want to say that we can also start, for example, Dr. Shugani said that it may be that this problem will go on till one first semester. So we have to complete the examination part also. So we can use this same platform and same things even for the assessment and the examination. And definitely technology know-how is important. Both should be technologically savvy, because if they are not good at it, it will be very difficult for them to use this. So these are the expectations from the teachers and the students. What preparation the teacher has to do it? The first thing is, it's very important, because many times we just give them the notes and all that. So now the teacher can, beforehand only she or he can upload on the, if they have the college website, so they can upload their notes and all that, so that the students can go through it whenever they are free, and later on wait for the actual session happening it. And YouTube channels also, they can have their own YouTube channels. If you have some videos to show to the students and all that, you can download it in your YouTube channels, and also in the Google Classroom you can have your all the things to be uploaded. What you can upload it? You can upload the lecture document. You can that is the scan copy of your own notes or your e-notes. You can have the pictures from the books, from the textbooks. You can scan it out, or you can also take the help of a video which the students understand better, video from the reliable sources. Actually, you also have a CD-ROMs of the textbooks also, so, and pre-recorded videos by the teacher. So all these things, and please remember the video selected should be having a good resolution, and also if it is better to have subtitles also, if it is in other language or something of that sort, or the teacher should in the background should talk about those videos. So this is the preparation has to do from the teacher's side. What the other preparations have to be prepared by the teacher and also the student. Here both are involved. One is for the live online. The streaming of the network should be adequate. It's very, very important. If your speed and all is not good, you will not be able to see the videos, and it will be very disturbing lecture or disturbing whatever presentation. So it is very important. And the didactic and AV presentation also can be done online. Live demonstration can be done online. Use the appropriate, see that there is a appropriate lighting and the position of the camera when you are doing the live demonstration. Use the darker sketch pen or the marker pen to improve the visibility. The audiometry commentary by the teacher while performing. And also definitely when the student is also presenting it, it should be performing, should be a good continuously, there should be an audiometry commentary. Why I'm talking about plan B. Plan B is very important, because anything can happen anytime. After all, it is a technology. And I give you a very good example. In 2017, we started the fellowship program. And first 1 week was the classroom and proper live program. It was physically, all were present. From the first week of October, we started with the online lectures, because we never thought that in October there will be rains. Believe me or not, my first online lecture, not mine means because I was the organizer or the coordinator. That's why I felt very bad. The teacher who came online, and with the Mumbai was full of heavy rains. So much of heavy rains, there was no network, nothing, and we had to reschedule the program. And we felt very bad, because it was the first time in my life I started online 2017 and on the Zoom, and we could not do that. So that's why we should always have a plan B program. That is what is plan B, is a recording or rescheduling. Rescheduling is okay. That is what I did it for that lady. But recording, what mistake I did, I never recorded her lecture. If I would have recorded it, I didn't have to postpone it. I could have just shown on the webinar during the webinar time, and I could have shown it. So I could have saved my time. So the plan B is also very important to carry on. So now I'll start.
Dr. Jyothika.
Yes.
Dr. Jyothika, the President, AIOT, Dr. Srivastava is here. Sir, welcome and thank you for being with us. And we would like you to address the gathering. We have a large audience, and once again, actually, you all have taken the initiative, and many of our universities, Nittar is here, Manipal, Jamia, Dr. R.K. Sharma is there, Santosh, many other universities can take the guidance from both of y'all and all of y'all to go ahead in these times. Please, sir, would you give your address?
Okay, thank you, Una. Can you hear?
Yes.
Hello, can you hear? Can everybody hear?
Yes. Yes.
Yes, sir. Yes,
Okay,
sir.
thank you.
Yes, sir.
Okay, thank you. I appreciate Professor Una Desai, the faculty of the Jamia Hamdard, Department of Rehabilitation Sciences of Jamia Hamdard, the Dean, Professor Manju Chugani ji, for giving me an opportunity to address this webinar. It's a very useful webinar being organized by the Jamia Hamdard. And thank you. And it is good to see that Dr. Jyothika Bijlani is here for as a resource person. I'm happy that you and the team of the faculty members of Jamia Hamdard have taken the lead to organize this webinar. And more so, it was an impressive thought to bring Dr. Jyothika Bijlani, Dean of the Academic Council of Occupational Therapy, as a resource faculty to conduct this webinar for the simple reason that she has been a sole brain for creating the smart clinical OT education model during the current COVID crisis. And, for AIOTA, the academic strength of AIOTA is Academic Council of Occupational Therapy, and Academic Council of Occupational Therapy is doing excellent work under the leadership of Dr. Jyothika Bijlani. I'm happy to see that Dr. Srivastava D'Souza from Manipal, Dr. Anurupa Senapati from Odisha, Cuttack, and Ruchi Nagar from Jamia Hamdard are the panelists for this useful webinar. We all have experienced how the COVID-19 pandemic has created a storm in our lives. Since March this year, since WHO has declared on 11th March COVID-19 as a pandemic, the deadly coronavirus has spread all over the world, keeping billions of citizens into lockdown and are in isolation. The health system worldwide is struggling to cope with the volume of the patients and the deaths world over. The situation in the country now is also getting worse day by day, with 300 to 400 casualties, deaths, and 10,000 plus corona affected every day. Unfortunately, there seems to be no answer to effective treatment and or vaccination for this entirely new virus till date. However, the efforts are on by all countries, including India. Let us hope for the best. The worldwide spread of the pandemic has almost disrupted the day-to-day activities of the whole world. People are facing a number of problems, be it food, medicines, employment, and of course, education. The pandemic has grossly overburdened the healthcare infrastructure of India and also even of the most developed countries, and is expected to cause post-COVID severe global economic recession. AIOTA and Occupational Therapy fraternity and professionals from across the country are with the government in its fight to eradicate the effects of this pandemic. You must be aware that about 550 members and OT professionals of India has volunteered their selfless services as corona warriors on request from the government Ministry of Health. And this is a unique thing from the members of AIOTA and OT profession for serving the humanity in its crucial time. And on behalf of occupational therapy members also and members of AIOTA also, AIOTA has also donated rupees 1 lakh at the PM Care Fund. As a frontline organization, AIOTA recognizes the need to quickly adapt in the changing scenario by modifying our methods of service delivery, redesigning our practice setups and modes of intervention. We as a CDS professionals are committed to coming up with practical solutions and guidelines during such crises or as and when it will be required. AIOTA's training module, OT Intervention in COVID-19 with narration, is prepared to be used as training for the trainers during Corona times. The module has received wide appreciation from the World Federation of Occupational Therapists, members of AIOTA, and also the Government of India. AIOTA has launched COVID-19 e-learning long and short modules on medical psychosocial issues being faced by the persons of all age groups, including those with dysfunctions and disabilities, during long staying at home, and it is launched recently on 2 days back on 9th June. The e-learning modules on varied areas of OT intervention will be useful for the OTs, healthcare professionals, caregivers, and also those who are interested. These courses are available now on AIOTA website and will soon be available on WFOT website also, and likely to be included in the government's IJOT site also. The pandemic has grossly affected the routine academic and administrative activities of AIOTA. The executive committee of AIOTA is all set to postpone its 53rd annual national conference of AIOTA, which was scheduled in January 2021 at Puducherry, and also the proposed fellowship programs and many other academic activities which were in the pipeline by ACOT. These activities also need to be postponed. However, I have requested Dean ACOT Dr. Bijlani to arrange all such academic activities by way of webinars as is being held today. To help protect the communities from coronavirus, the schools and educational settings are closed. However, the prolonged closures may lead to negative psychological and emotional impact on most of the students. Although gradually, to overcome the economic crisis, the business setups are being opened with necessary guidelines for protection, but it's not so for the educational setups. The school, colleges, and educational institutions are likely to remain closed till September, with the hope that situation would come to the closer to normalcy by that time. But this time, the scenario is that we don't expect that schools are going to open before schools, colleges, and institutions are going to open before September. The current educational disruption globally, with the long shutdown of the educational setup, is undoubtedly threatening the right to education. We need to restore education regardless of closure of institutions, though through the use of technology for UG and PG education in occupational therapy. Considering these aspects, the Academic Council of Occupational Therapy has taken an appreciable initiative to prepare a document titled Smart Clinical OT Education Plan during COVID-19 lockdown. I firmly believe that e-learning based on this document may prove to be an effective smart educational tool for the UG and PG education in OT in India. Principal and head of the OT education programs all over India have been advised to connect with their students through this smart clinical OT education program and technology, thereby prevailing educational rhythm among the students. I am confident the very success of this webinar, that has been visible and evident because of the 950 registration, as has been told by Dr. Noor Mohammed. I am very happy for this webinar, and it will be an initiative for other institutions to follow. Thank you very much.
Thank you, sir. Thank you very much, sir.
Thank you. Thank you.
Thank you, sir. Can I start?
Please, please.
Yeah, now, can you hear me?
Yes.
Yeah, okay. So now we will start with the...
Ma'am, slideshow, ma'am. Please,
yes, I'll do that.
Activate. Yeah.
Sorry. So we'll start with the smart technical OT education for the undergraduate program. So which has got, see, I have not thought of doing it like first year, second year, third year, fourth year OT program, but we thought of dividing them into foundational skills and then pre-clinical skills, and then the actual clinical skills, and the last is the internship. So this is what we have divided our undergraduate program accordingly. And we have a proper stepwise program, like how it is to be done. First, you have to think in the foundational skills, what topics you would like to choose, or what mode of instructions you will do, or preparation you will do, or the learning object, what will be the learning objectives from the student's point of view, and what task you will give, and how the assessment of those particular, you can say exam or internal exam or even annual exam you can, or semester exam you can conduct during that. So these are the different steps to be used when you are doing this e-learning program, or you can say e-teaching program. So if I start with the foundational skills, that is mostly in the first year and the second year of occupational therapy. So we mostly have the manual muscle testing, or IMT, and the gonometry. We have a splint paper pattern. We have activity analysis. These are the ones, see, we have chosen the topics which need to be used for the practicals and for the which needs demonstration, and which needs the hand-to-hand interaction, or hand-to-hand use of the students when they are working on it. So, and the job analysis and the history taking, which is actually why I have just written history taking, because in first year we don't have a proper assessment and all that. So only history taking we do it. So these are the basic lectures which we do it, and which they need the training, online training. So the gonometry. So I have given you all the sites here, and which also will be given in the references. So you use the gonometry because now you are alone, or you may be having 2-3 colleagues in your college while the students are at home. So you can, in beforehand only, you can show them, or you can send them the either the link, or I told you can show them, send them the lecture, your notes in your on their emails, or you can send it in your college website. So you can do that, which gives you everything, whether it the definition, the procedure, what type of gonometers, whether it is a circular gonometer, half gonometer. Anyway, I'm not teaching those aspects here, but the different variety of the gonometers can be shared, the definitions, procedures, the test positions, gonometer line, everything what we teach them normally when we are physically meeting them can be shared with them, and through this website, or through you can note down your notes and send it to them, or you can show them even the videos. So they have the videos also, you can show them the videos. simple, it is manual muscle testing or individual muscle testing, which is our Kendall is the best book. So you can also download the Kendall book and show to them or send it to them, or you can have a simple this flow chart, which simply tells when the muscle testing is 0, when it is 1, when it is 2, when it is 3, or when it cannot be done. So simple, this can be showed to them during if you are doing it online with them, or you can send it to them on their emails. Again, these are the different type of pictures which they will understand, like how you do the, what is the reflection, extension. I'm just giving you 1 or 2 examples. Each and everything is not possible. Again, there are different type of gradations, like when Kendall does in different way and Oxford does it in different way. So all the different methods are also given, how to do it, what are the positions, which are the anti-gravity positions, and which are the, this also can be shared with them. And these are the just simple examples which I want to show you. Then is activity analysis, also very important because the components are to be taught to them. Like how to show them which are the components, the motor components, the sensory perceptual components, sensory integrative components, cognitive components, psychological emotional components, and how the activity here, just if you see the video, how the activity is to be analyzed. So once they see it, and at the same time your the what you call it, the direction of teaching them, or the way what the person is doing it on a video is very self-explanatory. This is the stepwise. First you take this from the spoon, then you put it in the mouth, and how it is important even cognitively, socio-culturally, because socio-culture is also with hand, whether you do it with this hand, spoon, everything, and what are the safety measures to be taken, everything should be considered when you are talking to, when you are taking up taking the lecture on the activity analysis. So this will make, and there are lots of videos available. So with the different, like tying the shoes, feeding or dressing, any activity you wanted, you can do it, and you can modify as per the Indian culture. The paper pattern. So paper pattern also again becomes, that's in the first year occupational therapy. We show them how to do it. Now here the teacher is with the other teacher only and not the student, because they are working at present. So she can have a video on her whatever she's doing, or trying to show this, and side by side this is like a live demonstration, and the students are attending on that. So this is what is the paper pattern. You can, so different paper patterns, whatever as per your syllabus, you can do it. Yeah. So hand functions test. So hand functions test also, we have produced pegboard, we have Minnesota manual dexterity test, which you can also show them a lot of videos, which gives you each and everything, like the uses of this and their validity, their reliability, and also the values and what are their normal ranges, and which type of patients can be assessed, and how which type of cases can be assessed, which type of hand functions test can be taken. So those all are very important. So this is also per the pegboard, and you can show them the video. In video shows each and every aspect of it, how to pick up, how to do it. So they will able to understand it. It is exactly the same way how you would have taught them when they are in the college along with you. So now in your absence, you can send them the videos, or you can show them the videos, and that can be done. So this is what is hand functions test. Other hand functions tests are Purdue pegboard and Minnesota manual dexterity test. So these also can be done. same way. So you just show them the videos and they will understand. Now this is sorry, yeah. Now for the third year OT and the fourth year OT, we start with now the major clinical work. So that is pediatric conditions, cardiac conditions, amputations. So evaluation of these patients are necessary. So you can have your assessment forms and all downloaded and send them to the students, and few demonstrations also can be done. Now for example, for cardiac conditions, BP checkup and all cannot be done, but which they have already learned in anatomy of physiology and all those things. But few things they can very well learn it. But other things like amputation, crush injuries, burns, I don't think it is difficult. And if you just show them the different evaluation forms and all, they will be able to do it. So this is just an example of you can also demonstrate on the doll, because the student is she's at home and she wants to show the student how to check. This is a simple example of ACNR and ATNR. So she's just showing them how ATNR is to be tested and how ACNR. So this is just one example. Same way, all the evaluation can be taught on a doll, because you don't have any model available with you. This is another one. This is also, you have to, it's like a task. After teaching the student, you just give them the task. Like you give them the little history to the student and tell them that this is so-and-so child who has got 32 weeks preterm baby, and the chronological age is 2 months and 7 days and all that thing. And tell them, now you report what exactly you would like to do it. So this is what is very well shown in the different positions. I will definitely show you more of a pediatric videos, because that is my liking and that is my specialty. So and also the availability of the videos with me are more of a pediatrics. So this can be, see here I'm showing them also that how to do it, how to test this, and at the same time you can ask them to report it. So these are the different angles, French angles, which I'm trying to show them. These are the French angles, and again, the clinical, that was only of a pediatrics and all, but we also have the in medical conditions, surgical conditions, plastic surgery, cardiovascular surgery, all these. This is even the full OT program. It is not only the evaluation. That was more of an evaluation, and this is more of the complete case study. So they have to do the assessment. They have to also think of different type of approaches and different methods, and whatever entity they have to use, or brainstorm, how to use the brainstorm assessment and all. Everything can be taught on, I told you, either you use the doll or you use the videos, or you can have a model, somebody, your family member at home, and you can teach on that also. Anything what is available during the lockdown period, when you are at home, you can use it. So, but these are, we cannot, or you can have some mock scenario or some case history. You have the cases or your old cases which you have it in your at home or in your laptop. That also you can share with them and you can teach them. So these are again the videos how to do the gait analysis for the MSK student patients, and they will understand what is the gait cycle, and they can also understand what is the normal gait cycle and what are the different type of abnormal gaits which can be used for example, hemiplegic gait, or you can say the Parkinson's gait. He's showing the hemiplegic. So each and every gait, there are about 24 to 25 types of gaits in this video. So you don't have, and it is so self-explanatory that the student understands very well. Even this gait cycle is very self-explanatory, and how the cycle, the gait. What you call it, the steps are taken when the weight bearing is done, and what is the position when which leg goes into weight bearing, which doesn't go. All that thing is quite self-explanatory, and this is what you have to first show them the normal gait, and then you show them the abnormal gaits. So these are the videos, some examples which I thought I will show you, which you can, and all the sites have been given. You have to do little hard work to go through the videos and go through the YouTubes, and you will find it which you feel are more effective and for more informative as far as the OT students are concerned. This is another one. Now that was only the assessment on a doll. This therapist, he is also showing the different type of treatment. So how will you use your NDT treatment when the child is the CP child, or when the child has got, or the high risk baby, or the baby who is from NICU and she needs the therapy. So these are the different videos you can also show to the student, and they will able to learn it, that how to make the child roll, how to make the child by the NDT principles, and how to make the child sit or prone position or sideline position. Everything is you have to. So these are my old videos, and which I thought that I should be able to, I should share with you. So this is again the transfer training, which is again very important, from bed to bed, or from bed to wheelchair, or bed to stool, or bed to chair, or back to the original place. So again, this is also another videos which there are plenty of videos on the YouTube. You can choose any of it. Which this I thought it is quite good, and so I just thought of sharing with you. So you can also show the So I realized that when I went through the syllabus, I could imagine and I could feel that there is no need of a student to come, except the few things like checking the blood pressure, which also I feel that nowadays that automatic you get those BP apparatus and all, and you don't have to teach much to them. So quite many things, a few things which I thought that it is difficult to do it online, but the majority of things I thought we will be able to do it. So it's a very, I don't want to thank COVID-19, actually speaking. It is very bad. Whatever has happened is quite bad. But only thing is I thank, because of this, we have learned something new, which we can now use it. But I'm sure this is going to go. But in case in future we come again some problems, I hope we should not. But this will be always useful. Oh my God. Can I go back to just a minute? Sorry. Yeah. Now you have, I told you there are different varieties. So you can have it on a doll, you can show the videos, you can give your scenarios, a case scenario, or just a mock scenario to the student. And for example, this is a mental case, the dementia case, and you can start doing it that Mrs. A is a 62 years old woman, has been retired and all that. So you can show them all that. You can send them on the email, or you can show them like how I'm showing you. And the task can be given, this is the scenario is given, and then ask them the questions. The questions, actually, I don't know, it is missing, but the questions can be asked that what therapy, how will you handle this as far as the occupational therapy is concerned, and what modifications, the work modification the person will need this type of dementia cases and all. So 4 or 5 questions can be asked, and it can be, you can divide them into groups and let them manage, and then next time they can present it. So each and everything, I always feel that in this session, if they have learned something, give them the task, and for the next session should be for the students who will come out and they will give the presentation. So, and at the same time, when the students are presenting it, definitely the teacher has to have a lot of interaction with them, that wherever they have done some, whatever the mistakes, or wherever she feels the correction is to be done, she can do it either on a private chat, or she can, if she wants to teach in front of all full group, she can correct it. So there can be lot of interaction and all. So every session should be followed by the session from the student, and the teacher faculty has to have a lot of interaction and discussion and modification, whatever she feels. It's like a case presentation, and the teacher is attending. So this is how it is important. So the task is this is the student's role, the student's perspective, what we should do it. So it should be that the student can have it as specific evaluation techniques, I told you, techniques of NDT, or they can show the SI therapy, or they can show the assessment on Brainstorm. There's so many, or mirror therapy, or virtual training, or there are so many things they can show, and they can have a live demonstration either on their family members who are staying with them. They can use them as a model, and they can use the dolls, or they can do anything. So this is what is important from the student point of view, and on that basis, the teacher or the faculty has to, the group of faculties maybe, or maybe a single faculty who is only in charge for that particular assignment also can be done. And at the same time, the teacher can assess on them, she can give them the marks on that. So it can be through live demonstration, it can be through AV presentation, and it can be through the case discussion. So this is the student task is very important. So it is not only the teacher's responsibility to teach, but it is also the student's responsibility to learn and present it. So this will be a very good method of teaching and learning. And the submission. Now this is the next one. So AV presentation, or what I told you, this other things, he also has to do the submission. For example, if the person is not, they have recorded the video, so that should be submitted with this. It becomes like how they give us the P forms, they send us the prescription case study and all. So they also, this has to be submitted and it should be recorded. So they have to do it like on MMT, IMT, job analysis, activity analysis, the pictures of various plans, paper, pattern. So what I told you before is the same thing. The task has to be continued by the student. So I don't want to repeat again. And at the same time, the reflective journal writing of tools. I don't know, that tools also is very important, which I had a slide. I don't know, I have missed out that slide. So you can show them. There are a lot of pictures of the tools and equipment, their uses, and what are the do's and the don'ts and their contraindications, everything is given in that. So that also can be shared with them and let them make a journal and work on it. So the procedures are various, everything they have to, whatever you have taught them, it should be in the next session, it should be submitted by the student or presented by the student. The best way is also, another way is a quiz. So there are different ways I want to tell you that you can also use as a quiz. So you can make the groups. So you can make the groups, you can use it like you show them the hand function space, the pictures, and they have to say that, yeah, this is pegboard, or this is the Crawford hand dexterity test, or Minnesota, or whatever. So it will be, I told you, it should be interactive, and the student also is interested in learning also, and it is more of a competitive type. So the learning is always better. So when it is more of an interactive and informative and also the interesting. So you can make the groups and you can do it. Same way, adaptive devices, the splints, the gait analysis of videos. So you show them the YouTube videos and tell them to decide what is this abnormal video gait. And this is how they learn it through the quiz also. And you can also assess them. You can give them the marks accordingly. So this is one student who has done it at home, and she's testing the range of motion of father. And this is what, then she sent me the video, and I'm very happy and thankful to these students who have been taking it very seriously. And this is how, when she has sent me, I'm supposed to assess how she's doing it, whether she's doing it properly or not, and all that thing is important. Another one is case study questions to, this was the same one, that dementia case, which I said, I don't know, it has been shifted. So this was a case study, which I said it was just a case scenario. And these are the questions which I had written for the dementia cases, the what areas of performance are challenging for Mrs. A, and what you should have the support available for Mrs. A to minimize the impact, or what kind of intervention might you consider for Mrs. A, and can you think of any technological devices that could help Mrs. A to continue to participate? I'm sorry, this was misplaced. Another one is now by the presentation. So AV presentation, the student have to do it, and this is the actual presentation the student has sent me, and I have taken the picture of it. And so this is how the student has done the dysphagia assessment. So swallowing assessment, the student has done it and sent it to me. This is also, he has sent the, first he has sent the medical history, what the student, old man has a problem, and then later on, this was the second slide, which he has done the swallowing assessment and the physical status of the person. And this is through the mobile. I'm interested, not the mobile. I want to say that the relative has taken the pictures and has sent to the student. So, and again, he has sent the correct method, what this is the incorrect method, and this is the correct method. And this is like a tele-rehabilitation also. And at the same time, it was a learning for the student to do it. So this was very well done. I was very happy with the student who did this. Now the teacher's role. Teacher's role is important because it is you have taught them, they have learned it, but it is important to do the individual appraisals, suggestions, corrections should be suggested to each personally, which I already told you, through the mobile or personally or maybe in collectively. Some common errors can be also, I told you, can be discussed there and there only in the next e-class meeting. So the internal assessment, the scoring can be done on each and everything, like on the submission, on the presentation, on the quiz, on the individual presentation, like what I showed you on the simulated case or the group discussion. So this is what is important from the teacher's point of view, you can do it. This is another case presentation which the student sent me. It was just a presentation, a short case. The exam has been taken, so we just told them that whatever your old cases you have it, you please tell us. And the short case, so he has done it on a balance, I think, yeah. So the balance, Berg balance scale was used on this patient, and he has given the background. So whatever the scoring was done, he has the total scoring is 11 out of this 56, and whatever the occupational therapy program, he has sent it to me. And this is on this basis, the evaluation is done, and the the assessment can be done. So this, as far as the UG is concerned, we can do this. Now the internship is very, very important, and we all know that interns have to be full time in the institutions, and they have to take care of all the patients, definitely under supervision. But many times we also allow them to work independently, which they have been missing it during this time. So we have to make use of it. So we see that what other things they can do. The best part is they can be used as online training courses on the COVID warriors. So which is important. CPCR, which we always send them for the courses in the anesthesia, OT, the operation theaters. So that also can be taught to them online. Then online courses, they should be forcibly told to attend, like today's webinar, for example, or whatever webinars Jamia has been arranging, or other institutes have been arranging. They see that all the interns should attend those, but certified by the occupational therapist. Involvement in the tele-rehabilitation. All the institutions have now started with the tele-rehabilitation. So see that they are also involved in it, so they understand how they have to teach the patients through the internet, or through the whatever you call it, e-rehabilitation, or mobile health delivery also can be done along with the faculty. Definitely along with the faculty, they should be involved. You give them some projects which are already. So projects can be, you prepare the sensory kit, or you prepare some evaluation kit, or something SI kit, or anything what you feel they should learn. So that project, sitting at home, whatever the available things are there, you can give them the project, or they can also make some movies, some videos picking up from this, and some new you can tell them to prepare a bank, of all the videos, and different type of methods of you can say the techniques, and the any other things. I'm trying to get those things. So any project you just give them, and which you feel that the institute needs it, and the department, this is the best time to make use of the interns. Otherwise they don't get the time. So volunteering for the COVID-19 affected patients care, reviewing the research articles. This is important because it is going to be useful for them even later on for the master's program. So you can tell them to do it. Conducting online survey on the Google Forms and Google Doc and all that. So because that nowadays it's very important, can be used, and it is important. So then making a video bank for the department for the available, from whatever available videos are there. So that video bank, which I already told you, which can be done. Collaborate and participate in e-debates and e-discussion. How we had a quiz for the individual classes and individual, but at the same time we can have it the similar way. All the interns of all the colleges, we can tell them to take part in e-debates and e-discussion. This way also they will learn much better. So these are the different types of programs which you can use it. Again, the clinical based scenario, which is for each and every person. Now, even for the 4th year and 3rd year, I gave you the example which they can also continue with it. And the e-log book. So log book is important for the interns, so because they will not be able to do it, so you can tell them to do it on it should be on an e-log. So this is internship program, and the postgraduate program. The postgraduate program is we have divided because they have the research project always. So we have to think what research project they have to do it now, because actually speaking, the postgraduate students should come personally and physically in the institutions, but it all depends from the institute to institute. Some institutes are allowing them, some institutes are not allowing them, because they are the full-fledged therapists, so they have to take care definitely. But if they are not coming, we can make them learn online, and these are the programs. So they have to learn with the make the e-survey, or you can tell them to do some case studies, or reviewing many types of literatures and many types of articles, and which are going to what they would like to work on it later on, so that they can do it in a as far as the research project is concerned. So they can instead of directly contacting the faculty or the PG guide, they can email them that this is what I have thought of doing my studies, and the teacher can again verify it and assess it and send her inputs on that. The clinical based learning very important, because again because they are not present over there, so you can also tell them that it should be, because it has to be evidence based practice. Nowadays we don't allow anything which is not evidence based, so they have to learn which are the evidence based you can say the methods or the approaches or techniques, and even how to do model of consultation is important. The principles of practice, frames of references, all these things are important, because these are the theoretical foundation. Basically, if they have not understood, so they have to first learn to have this review, how to review the programs and how to do the research design. In fact, the research designs and all, it should be made, it has been already made compulsory for the interns and the PG programs to attend those programs. So nowadays, you make them attend online research programs where everything will be taught to them, and then they can use for that for the research projects. So those are for the foundational theoretical foundation. Other is clinical base, is then what they have learned it, they have to use it in the clinical base scenarios. So they have to also decide what is evidence based and what is their own way of treatment, what he or she has a thought of planning and with the clinical reasoning. Because I always used to tell the student, for each and everything, the why has to be there. Why you are thought of doing this, why you are thinking of doing this assessment, why not this assessment, why you are thinking of testing the person on a Purdue pegboard and not on the Minnesota and not on the Crawford hand function test, or why not on the Jepson Taylor. So there has to be why for each and everything. So that why is the clinical reasoning. So even not only for the assessment, but also for the treatment intervention point of view, why you are thinking of this, giving this, so that they can decide, and there has to be some evidence base. So they can say that this is the evidence, and according to me, you can little bit modify it, and to give your clinical reasoning, and the involvement in the tele-rehabilitation, which I feel is a must. Because you can't hear. Hello, can you hear?
Yes, ma'am, you are audible.
No, before I was not audible.
No, you are audible, ma'am. It's good.
Acha, okay. Before also, no? Sure, no?
Yes, ma'am.
Okay, fine. Suddenly I realized that I am talking and nobody has been hearing me. Anyway, you heard, no, everything. This is my last one. So, as far as the skill demonstration is concerned, it is exactly like interns and exactly like UG people. So they have to show it online, the manually, or they have to show some available videos, or they have to show the recorded videos. The micro teaching, micro teaching also they can do it online. For example, the teacher is teaching to the students. Same way you can tell the PG students to do it, the micro teaching on online, and the faculty should be available for everything. I feel that there has to be a supervision by the faculty, because I did not say initially, but it is understood that they should not be allowed to do independently. So particularly micro teaching and all, it should be in front of the or the presence of the teacher should be available. So this is what is my postgraduate program, and I this without fail I should acknowledge Dr. Anil Srivastava for his proactive leadership and exemplary vision towards upliftment of OT education and practice. I told you without him I wouldn't have been here today. Thanks to Dr. Shreyas Jagidar, who is a faculty of OT School and Center, TMC, BYL Nair Hospital, for his hard work in compiling and editing of the document also. So he was also quite helpful when we were preparing this document, and also sharing his special inputs. Sincere gratitude to Trupti Nikarje, who was, you saw the lady who was showing it on a doll. So she's the one who is, thanks to her and for sharing her videos. We are also grateful to all the office bearers and the executive committee members of IOTA and ACOT for their support and valuable suggestions. With sincere thanks to all the faculty of IOTA accredited colleges in India for their valuable inputs for this document. And also, I would like to acknowledge my UG, PG fellowship students for sharing their online task presentation, which I have already shared with you. And I should not forget to thank all of you who have been listening to me and patiently. And I hope you have learned and you will try to implement on it. The students I'm talking about, the task and activities, you take it seriously. And this is the only good opportunity to learn. So these are my references, and stay safe and stay healthy. Thank you so much.
Thank you so much, ma'am.
Thank you.
Thank you for such a wonderful and informative
Noor,
presentation.
you need to
Sorry.
unmute.
Sorry. Yes, ma'am. Thank you for such a wonderful and informative presentation, ma'am. Not only for occupational therapists, but also for all the faculty members of every stream, this presentation might be of great use. Now, proceeding further, I would like to start with our panel discussion session, and I would like to invite Dr. Sebastina, Dr. Anurupa, and Dr. Ruchinagar Bakshi to proceed further with their views on the presentation. Starting with Dr. Sebastina.
Or questions, you can give the views and then how you also may be able to implement them. And there are lots of questions also.
Yes, ma'am.
Please. Dr. Sebastina.
Okay, so good afternoon, everybody. Thank you. It is a privilege for me to be able to connect with my teachers, even though I'm in a place of Manipal, very far away. So in this COVID situation, it's an opportunity, and it's I'm very delighted to see everybody on screen. Again, first of all, let me thank Bijlani madam for a wonderful presentation, and for a very good initiative as a Dean ACOT in compiling this this smart document to facilitate clinical skills of our students. I think it's a very completely thought of kind of document where they have seen from all angles. In Manipal, we do not use Google and other things for any classroom teaching, because we have our own we have Microsoft Teams, which has all the necessary features to facilitate classroom, and we are not encouraged to use any other free software. I know that Google has a Google Suite, which is paid, which has more safety features. So this could be a suggestion, that because increasingly safety is becoming an issue with Google, Skype, everywhere, encryption and safety, all the free modes is a concern. And when we're talking about student videos and student intellectual property, I think these are very valid reasons to be concerned about. So I would just suggest that all people who are using online modes for their regular teaching would think about approaching their university for paying or paid that you have more safety. Everybody is safe, the student, the university, and the faculty. That's one thing I would suggest. Um, uh, Secondly, I would I would think about my major concern in this whole thing is about the occupational based practice. Usually, students are able to understand the NDT SI because you can show it with a doll, or you can show it with a big or small doll. But the issue really usually is about how to use occupations. Well, I don't think it's a challenge because every house has a kitchen. Every house has that's what we need, an ideal area. The living area is our playground, or is our clinical area. So I think this is an excellent opportunity to be able to facilitate students and patients in their living setup, in their context, and really have occupation focused and occupation based practice. So we have been doing it over here where we have sessions with the patients and their patients. For example, in pediatrics or neuro, not much in neuro so far, but more in pediatrics where we have consultation online and the students participate in it. But besides the SI or NDT kind of practice, we also focus on play, on toileting, and since it is their home and we can see the home, we are able to give more a person directed or more client centric solutions, and the students are a part of it. So they may not. PGs are allowed to intervene. They get more responsibility, but the students are not allowed. But they can watch. And then following that, the whole video is recorded with permission. Please remember, if there is any patient involved, we have to take permissions earlier regarding the use of it, or we declare that it will not use for any purpose other than academics and will not be put on YouTube or anything. So those are extremely important, the permissions from patients. And the student is asked to use that. So we use a lot of reflective learning here, where the student has to reflect what happened and what questions were asked, or what would you ask in the next case. So these kind of things we are trying out in this complex or difficult situation. So in addition to everything, I would just think that it's a good opportunity to see the occupational, to emphasize on the occupational focus here, because you have an opportunity to do it actually, since the student is also living in their home, there is everything there, and the client also, but safety and permissions and ethics is a concern here, of course privacy. This is also open, some funny person may misuse it on the pretext of education. So that is again something, so anything with a student has to be monitored by a faculty. And it should be very clear that the student cannot, and even the patient party should be told that we should not encourage any call from a student if the faculty is not involved. So these are some ethical aspects of things which probably need to be considered. That is the main thing. And the last thing I feel is, although the critical thing over here is not the technology, but the teacher's preparedness. Do they have the maturity, skill, and intelligence to think so far ahead? Because when it comes to online learning, you have to anticipate. You don't have feedback from the student's face, and you have to plan the session much more in advance than you would do just go in a class and take it how it goes. So that luxury we don't have. So I also feel there needs to be some teacher preparedness. Here we are trying to, this is especially, I think it's for everybody. Senior faculty may be very good in teaching, but they're not techno-savvy. Junior faculty may be very techno-savvy, but are not sensitive to teaching. So I think you need to tailor make this, and we have a very wide group here. We have some very young faculty, and me, I'm in the older category. I don't look old, but I'm in the older category here. So this is, I think, the most critical aspect over here, but also an advantage because junior faculty can be shadowed by the senior faculty. They can be a part of the webinar, to ensure that there is feedback. Otherwise, it is difficult usually to have a faculty sitting in a junior faculty's class. We had the protocol, but it was not something that was liked. But this is an online platform. I feel for a junior faculty, it might be good. It might be also good for a senior faculty to have somebody to sit on his class so that there is some feedback about it. In addition to this, usually the problem with every online class, including clinical, is we tend to ask them to switch off the video because the load on the internet is high. But you need to make sure to pay attention. So having quizzes in the middle, in between the session, having a quick MCQ during the session, or having giving a spot thing during the session is something we do. Like, so a quick MCQ is sent to them and they have to answer it. Or we call out names and they have to do a small presentation of what was discussed. This makes sure that they are there, and we also make sure that they are dressed properly. We ensure that they are told that they have to be dressed properly, sit properly for anything. They cannot give excuse in the middle of not wanting to put their video on. These are basic etiquettes which I feel are important, whether it is in person or whether it is online. So these are things. However, the concern still remains. We may be able to help in reasoning a little bit, but the concern still remains is, will they have the actual clinical skill when a patient is involved? So that is an aspect which right now, hopefully it's a very temporary solution, but it will be a problem for the current first year, second years if this problem continues. At least third years, fourth years have had some clinical exposure and we have an idea they can catch hold from somewhere. But this first year, second years, now when they come to clinical area, we are worried about them. How will we facilitate clinical things? So we won't be relying entirely online. I don't think that is going to help. So we are thinking of ways of which we rotate it so that we have fewer students, and there is less crowd, but they will not get the same number of hours that they would otherwise get, just to ensure that they have some practice, but under safety concerns. But these are all under the university guidelines. So we don't have discretion. These are all under university rules, but we are thinking in that ahead. And we are all moving to OBE, so outcome-based education. So actually, that is helping us a lot. This has this whole system of tables and making plans, which forces you to think ahead. You have to actually note down every detail of the class, much in advance. That is actually helping us now. So we have something in hand to help in this emergency situation. We didn't have to start from scratch. So those are the things that we are doing right now. And I think such kind of plans would really help places, help most of us in managing this current situation. So that's from me. Thank you, madam.
Thank you, ma'am.
Anurupa? Noor, please invite Anurupa.
Yes, ma'am. Thank you, ma'am. Thank you for your valuable feedbacks. Now, I would like to invite Dr. Anurupa Senapati to provide her feedbacks. We welcome you, ma'am.
From Nirtar, what is your experiences?
Good afternoon, ma'am. Good afternoon.
Good afternoon.
First of all, I thank you, ma'am, and thank you, Bijlani, ma'am, to develop this module. It's really helpful. And during this difficult situation, all of us have to depend on the online teaching. And in SV Nitar, we used to take the classes on the Zoom app, not on the Google Meet. And in our setup, they have not provided any kind of Microsoft meeting. So therefore, we are taking on Zoom app. Theory classes, what we are taking, all the teachers are preparing, and from first year till final year, we are taking all the theory classes. And on the clinical part, we are not using many of YouTube videos, but we have made our own videos in the clinical setup, because we are going to the college. So the students are not there, but we are making our interns people are there. So by taking the help of our interns people, we have made our own clinical videos, like on muscle testing, joint range of motion, as well as like testing all the reflexes. Those things we are giving to the students. By showing the videos, we are teaching them. And on the clinical aspect for the intervention part, as I strongly agree with Srivastava ma'am that whatever the occupational based videos we have developed by taking some models like our students are the model, and depending on the conditions, like for hand injury patients or like stroke patients or like spinal cord injury patients, so we have made the clinical intervention, and we have taught the students by using those videos. The difficult part, what we are finding, that is for our post-graduation students, that is regarding their thesis, because that is the most problem for them, how to take the data. Like in the now like final year students of MOT, they're supposed to complete their thesis. Now the theory parts like introduction and all, they are able to do it, but data collection is a major problem. So it's like how they are going to make that part. That is a difficult task for us, that how they are going to complete that. Even I was trying to ask Bijlani ma'am what they can do, because they are in the halfway. So now they are unable to complete that data collection. So that is the main difficult task for us. And now if it is going for a longer period of time to shut down, then it is very difficult for them to complete their degree. So that is the most difficult part what we felt. But overall, this module is really helpful for us. And like ma'am has incorporated that whatever the points we have to do it for intensive students, that part we are not doing it, because all our interns have joined back, all the patients are coming to us, so that is not a difficult part for us. But only thing is, and for UG students, we are able to take all the clinical part as well as theoretical. But the PGs, their online teaching is going on, online seminars are going on, assignment is going on, assessment is being done, task is also being recorded and evaluated. So those things we are doing for post-graduation. Only the problem is their thesis. So overall it is what ma'am has guided us, that will again definitely help us more. But we are doing this way, but only thing the Zoom app, like which is not very relevant. So that we are using, because in our institute nothing has been provided to us. So we are requesting our director to provide us a Microsoft Meet app by which we can do in a better way. So thank you all, ma'am, for your guidance.
Thank you, ma'am. Thank you for your feedback. Now I will request Dr. Ruchi Nagar Bakshi to present her feedback and views over the presentation.
Good evening, everyone. First of all, I would like to congratulate Mrs. Bijlani and her team for developing such a module, e-learning in occupational therapy, and that too in such a small time, like mid-May, we all had these guidelines circulated to us. So we have been using Google Meet, Google Classrooms, Zoom for taking classes, as well as for assessments, presentations of the students, UG and PG both. But yes, preparedness is one thing which we are facing problem, because it's just not limited to this. It is presenting what, as you had mentioned, the foundational skills, clinical skills, and preclinical skills. So those video preparations, that to an Indian context, that we are still to do. We may have things from other contexts, but Indian context, we have to maybe give it to the students in some way. Yes, it will enhance our arena in terms that we can go into the patient's environment, we can assess the patient's context, and of course I agree with ma'am that few months ago most of us thought that the traditional way is the best way, that is face to face. But this current situation has forced us to think in a different manner. We are now trying to find out different ways to reach out to the students, help them, and utilize the virtual methods. So far we have been using demonstrations, videos, providing the students with the links of the existing sources, having discussions, lectures, but we have a long way to go. We are doing it in small groups, and I'm sure that as we go ahead, we'll get problems and we'll find solutions for them. And we are sure that these guidelines will help us to go ahead and conduct the whole semester and the whole annual thing. And it would be better if we collaborated. Like different schools also collaborated and exchanged the materials. So that will make us a job more easy. That's what I have to say.
Dr. Manju, would you like to say something before the questions come? Please.
Ona, you can also ask Dr. R.K. Sharma also if he's there.
Yes, yes. So would you like to add? Then I will ask Dr. R.K. Sharma and others. Would you like to say something?
Yes. Sir, Dr. R.K.
Yes.
Dr. Manju and then Dr. R.K. Sharma.
Okay. I am so thankful to Dr. Bijlani for preparing these guidelines. I think we have done this, but not in a guidelines manner for our faculty and other places, other department. We are also preparing a list of procedures, each batch-wise list of procedures, and some procedures will come out to be common. And I think the idea of collaborating, I have also noted down the point and wanted to convey this, that the institutions like Manipal and other institutions, wherever these programs are there, we should collaborate, I think, 4 or 5 institutions and prepare a list of procedures and the list of videos, list of educational material already existing online, and then put another column making it as to be prepared, and then divide it to be prepared, so that in a shorter time we will come out with the solution. And the methods and also the idea of Sebastian having a quiz in between was a wonderful idea to keep them on track in between the session also. And I think mixture of junior senior will give us a very good results. And outcome based education, we are going to go for this. We have to go anyway for this. And Ruchi was rightly saying that this has taught us that apart from the traditional methods, these methods are also there, which we were not utilizing so much, but now we can utilize. And I really appreciate the internship program which she presented. Apart from the other methods, that videos, mannequins, case scenarios, research, clinical-based education, micro-teaching, all other things. But this internship program is prepared very comprehensively. And the way we are developing in one department the list of procedures existing to be prepared, and then dividing them and coming back into one platform. I think it is good that now we don't have to limit ourselves to 4 walls. Other college students and other people also can attend from sessions, and we have some experience, many experienced teachers here, and Manipal must be having. So we need to exchange these sessions. That is what is my request, and of course the reflective thinking. So thank you so much for this session. It was a wonderful session, and with lots of ideas, and I think we are going to call.
Dr. R.K. Sharma from Santosh Medical has joined. Sir, would you like to say something? And we'd like you to say something. Dr. R.K. Sharma, please, before a few question answers. Sir?
Sir is there.
Dr. R.K. Sharma? All right. Can we take a few questions, and the remaining questions could be named to them? Nahid, would you start with a few questions for these people?
Yes, ma'am. A very good afternoon to all. There are a lot of questions on how to apply the theoretical concepts to the practical ones. Most of the questions are related to this thing only. So there are questions like how to combat COVID-19 as an occupational therapist. And a similar question is how to follow toileting procedure in bedridden patients in this pandemic so as to prevent the patient as well as the caregivers as well as the therapist from the COVID-19 spread. How to take care of that?
Can I answer this?
Please.
Yes,
yeah, actually, questions, these type of questions have been asked, I think, since last 1 month or so, because the people want to practice occupational therapy, but they are all, again, that scared. The fear is there that how to practice it. And I think Dr. Srivastava already said that we have come out with those video modules. In that, we have two types of modules. One is like occupational therapy for the directly COVID patients, and others are how to handle or what are the safety methods, how to practice the safe occupational therapy. So if you go through those videos, which are already on our website now, available since I think we just launched it day before yesterday, and you can go through it and you will get all the questions, what care should be taken, how to be taken, and everything is given, and how to sanitize your equipments, and everything is given. So I think it's about 20-25 minutes video, and that will help them. That's what I feel.
Thank you, ma'am. Ma'am, there's another question again related to the practical skills. The question is that our students, we need to impart the clinical skills, the hands-on skills to the students, for them to be able to better diagnose the patient and treat the patient. The problem is that in the online modules, maybe we've not developed them so much that the practical, how to assess that skill and how to impart that skill again is a problem. So what do you think we should do for that?
Anyone wants to answer? Sebestina, Anurupa?
May I could just tell something here?
Sure.
I think that's a very valid question. But I think what at this point of time, I mean, there is a general concept that, BOT mein sab kuch padna hai, sab kuch aana hai, and which is good, but it is not all actually happening. We have to learn some core skills. So I would think that the students have to make sure that even after they pass and this whole episode goes off, they need to make sure that when they start working also, they do something to learn it themselves. Because teaching is, when they are studying, you're not only studying the content, but you're also studying how to teach yourself. What resources you could find to empower or learn yourself. So if they could not do something now, it's good to note it down. And when they start working, see with what resources you could pick up on these skills. So learning doesn't stop at BOT teaching. You need to make sure that you're always learning or be aware of aspects you did not have much exposure to and you would like to expose to. So identify a mentor when you're working, identify somebody whom you know in that area. And these are strategies they need to think. So you have to start thinking of as a continuum of lifelong learning in reality. Not just BOT ke baad ya MOT ke baad सीखने की जरूरत नहीं है. But having, like I said, we are encouraging a lot of reflective writing over here. What aspects you want to work on more, what aspects you feel confident on, just note it down. So tomorrow it may be useful to you. The second thing, what I was trying to think about as a suggestion for the previous question on toileting, at this point of time as therapists, I think we can only be facilitators. So, if you're able to find videos that a patient party can use to help them in that particular situation, I think those are some suggestions you could think about. You can't actually do it for them, but if you can help them, just find a resource that may be useful. I think that also is a role of occupational therapy, since we cannot do something hands-on right now. So many times we are doing that, just, okay, why don't you look up this video, or why don't you order this from here, or why don't you, find out from, why don't you look up this website where you will get so much more information. So we can help them in that manner. I hope that answers the question that was raised regarding toileting. But giving some support is better, is what we can do right now.
Thank you, ma'am. There's another question by Dr. Kalpana Zuchi. Since the COVID-19 pandemic is very unpredictable in its nature, we do not know when we would be able to function fully. So how will we be able to distinguish or justify regular courses like ours to the distance education courses offered by many universities? So that's her question.
So Dr. R.K. Sharma has come. He has joined. He was there actually, but he was muted, so he couldn't talk.
So he can join and would like to say something. Sir, I invite you. Yes, your viewpoints, sir.
Hello.
Yes, sir.
Dr. Sharma, I think, has left the meeting.
No, he has not left. He was there.
Again.
Yeah, there's some
No, he was there.
connectivity
He's
issue.
left. Again,
I thought, okay.
connect.
So that question is to be answered, no?
Yes, ma'am. How do we
The
justify?
audience and
So I want to answer this for the distance learning. Yes, definitely. I always pray God, and I always wish that this will be going. COVID-19 will go soon, and so then later on our life will be as what it was. But definitely this is a good question, because what will be the difference between the distance education and at present whatever we are teaching it. But this is it's a 4 years course, and distance learning all 4 years is online, because there's no physical presence and all that. But while I expect this COVID-19 to disappear, so that is the difference between the distance learning. And yeah, a few things definitely the students will be missing it, but we can cope up. Like, we need not give them the vacation and all that, which happen every year and every semester or whatever. It depends upon what you have the program. So then we can compensate by whatever is missed out during this period. We can cover up whenever they are present in this. So please don't compare it, because that is 4.5 years, and I'm sure we will be back within few months to our normal life. Thank you. And one more thing I wanted to say, I'm very happy to hear that yes, I agree with whatever contribution. I feel that all the colleges should get together and start sharing your programs, because you don't have much time. So for each, so maybe you can decide, you look after first year, second year, third year, fourth year, or sort of that thing, and start sharing your things. So it will be helpful to everyone. So, and as far as Anurupa is concerned, yes, thesis, she was saying, yes, it is a concern, but only thing is, I'm also surprised that interns are allowed to come and not the PG students. That is really surprising. And I told you, it all depends from the institution to institution. Because I was just thinking that PG students are the full-fledged therapists. In fact, they can, if the patients are coming to your institution, because the number of this load is really, really reduced now, and everybody is scared of it. So now that OT practice, what I told you, that video will really help you. So I think they can come to the department. They're online, if they can assess whatever, depends upon what they have thought of their thesis and all that, how their assessment is to be done. But those students should be allowed. If interns are allowed, why not then PG students? So if that is up to the institution, but it should not be very difficult. If the therapist can come, why not PG students? Yeah. So if it is not manageable online, can come personally, and they should not suffer as far as the thesis is concerned. This is what I feel. This is my suggestions. Thank you.
Yeah. Okay. Thank you, ma'am.
Nahi, can we take a few more questions, or we will have to circulate these questions and give it to the panel as well as our Dean ACOT? So do we have time? Deepak, do we have time for a few more questions?
Ma'am, I think we can proceed with the vote of thanks. We can end it for now. And questions can be mailed to the Dr. Jyothika Bijlani and all other panelists.
And the panelists.
Yes, ma'am.
Okay.
Yes, ma'am. Yes, ma'am.
Now, I will like to invite and request Dr. Sorab Ahmed Khan, Associate Professor, Department of Rehabilitation Sciences, Jamia Hamdard, to deliver the vote of thanks. We welcome you, sir.
Okay, thank you. A very good afternoon to all respected resource person, Dr. Jyothika Bijlani, Dean ACOT, the AIOT President, Dr. Anil Kumar Srivastava, respected Dean Professor Manju Chugani, and Head of Department Professor Ona Desai, the panelists for the webinar, faculty member, and my dear student. First of all, I would like to congratulate the Rehab fraternity, Jamia Hamdard, in association with IOTA to organize this webinar, which was most needed for us during the uncertainty of the pandemic. On behalf of the entire Department of Rehab Sciences, I would like to thank respected speaker, Dr. Jyothika Bijlani, ma'am. Ma'am, your valuable information and input will definitely help us to create a comprehensive platform of e-learning, mode of instruction, and establishing effective way of teaching and learning process, not for the only occupational therapist, but for all other professionals dealing with the human well-being in the new challenging era. I would like to express my sincere thanks to Dr. Anil Kumar Srivastava, sir, for his valuable word and for introducing the module of Smart Clinical OT educational plan during COVID-19 lockdown phase. The module developed by IOTA under the guidance will help in overcoming the clinical learning challenges and the loss of clinical learning hours in occupational therapy during the COVID-19 pandemic. I would like to take this opportunity to express my sincere gratitude to Honorable Vice Chancellor, Professor Syed Hasnan Bashnan Sahab, and Pro Vice Chancellor Dr. Ahmed Kamal Sahab. Under their patronage, Department of Rehabilitation Sciences has always promoted various ICT platforms and committed to organize these events to dissipate knowledge by collaborating within and outside the university. I, on the behalf of Department of Rehab Sciences, acknowledge and thank our registrars, Dr. Syed Saud Asar Sahab, for providing unconditional support related to all such programs. I want to express my heartfelt gratitude to our respected Dean Ma'am, Professor Manju Chugani, for her constant dynamic guidance and encouragement in promoting all kind of teaching and learning activities to achieve the academic excellence. I extend my sincere thanks to our head of department, Professor Unna Desai, for encouraging and providing equal opportunity to every one of the department for initiation and organization of such kind of teaching learning events. Ma'am, without your support and guidance, this could not be possible. I extend my thanks to Ms. Rahil Beg Sahab and Kulzar Ahmed Sahab for their enormous cooperation and technical support in the organization of this event. Further, we are grateful to the panelists, Dr. Srivastava Anita Ma'am, Professor Department of OT, Manipal Academy of Higher Education, Dr. Anurupa Senapati, Head of Department of Women's Therapy, Director, and Dr. Ruchi Nagar Bakshi, Associate Professor, Department of Rehab Sciences, Jamia Hamdard, for providing their valuable input to the webinar. I must mention our deep sense of appreciation to the organizers of the webinar, Dr. Ruchi Nagar Ma'am, Dr. Deepak Malhotra, Dr. Noor Mohammed, Dr. Saudi Srivastava, Dr. Nahid Khan, Dr. Prachi Tiwari, and Dr. Saheb. At last, but not the least, it gives me great pleasure to thank you all participants for their enormous response to success of the webinar. Thank you very much.
The last word, I think Dr. Dr. Sharma is here, the Dean of Santosh College.
Yes, sir. Sorry, Dr. Sharma. Thank you, sir, for your continuous presence and encouraging us. Thank you, sir. Thank you.
Thank you very much. I have really enjoyed this topic, and it's a very academically valuable. And I'm sure that with this media, the way we are developing our occupational therapy profession and other fields.
And Sophia, head of department from Nagpur, was also there. And actually now we should break the boundaries and we all should get together, and in these times we would be able to knowledge share across all the universities and departments and across disciplines which are related to us. Like we work very closely with physiotherapy, with nursing, with many of the clinical facilities, and maybe we could develop something, because in a short time we need to do that. So I must thank everybody who is here, and it was a very fruitful seminar, and we must have many of these in the future. Thank you.
Thank you, ma'am.
Thank you.
Thank you. Yes. Yes, Noor.
Can we have any some concluding remarks from our Dean, Dr. Manju Chugani, ma'am?
Okay. I actually spoke before, and Dr. Sharma I met many times. Two big messages, if I have to summarize whole thing, is one is teachers' preparedness is one, and second is collaborating or coming together. These two are the main messages out of the whole discussion. And thank you so much. I think this was needed seminar. This was really required, and this has created a lot of thinking process. and we all will come together and work for students' excellence in the profession. Thank you so much. Thanks everyone, Onaji, Saurabh, Noor, Ruchi, I think everyone, each one of you.
Thank you, ma'am.
Thank you so much.
Thank you.
I'm grateful to all the dignitaries,
All of
panelists.
you and you can prepare this Nahid, and you please send it to the panelists so they can answer the questions as well.
Yes, ma'am.
Thank you.
Ma'am, we have Dr. R.K. Sharma again with us. He was disconnected. Dr. R.K. Sharma, sir, can we have you?
He's driving.
Good evening.
He is
to all of
driving,
you.
ma'am.
Yes.
Good evening to all of you, madam, and Dr. Ona. Excellent work under your patronage. And good evening to your dean, madam. I know her very well. She is very dynamic personality and working very hard to develop the at institutions. And thanks to AIOTA and ACOT, and really great words needed for the Dean ACOT, who is doing very, very excellent academic works. Thank you very much. Thank you.
Thank you. Thank you, sir.
Thank you. Thank you all.
I am grateful to all the dignitaries, panelists, Dr. Jyothika Bijlani and participants, Mr. Rahil Beg sir, Mr. Gulzar sir, and all the organizing committee members and faculty members of Department of Rehabilitation Sciences and Jamia Hamdard for making this event successful. Soon we will be coming up with our another webinar. Till then, stay safe, stay home and take care. Thank you.
And thank you to Deepak as well. He had run the program yesterday and today. A big thank you, Deepak.
Please, ma'am. It's okay. Thank you. Thank you.